Hey there, and welcome. Today, we're doing something a little different. We're going to give an entire nation a checkup. Yeah, you heard that right. We're going to play detective and uncover the secrets to a country's health, all by using these fascinating things called health indicators. So, let's get our investigation started.
So let me just ask you this straight up. How healthy is your country? I mean, it sounds like a simple enough question, doesn't it? But when you really stop to think about it, how would you even begin to answer that? It's a huge and honestly one of the most important questions we can ask about the society we live in.
I mean, think about it. If it's just one person, it's pretty straightforward, right? We've got thermometers, stethoscopes, blood pressure cuffs, easy. But for a whole community, for millions of people, whoa, that is a completely different ballgame. It's a mystery on a massive scale.
And that is exactly what we're going to do today. We're going to become health detectives. Our mission, should we choose to accept it, is to follow the evidence, piece together the facts, and crack the case of a nation's health. And every good detective knows the first step is to get your toolkit ready.
So let's crack open that detective's toolkit. These are the specialized instruments, the magnifying glasses and fingerprint kits that we're going to use to measure the health of an entire population and uncover the truth. All right, the single most important tool in our kit is something called a health indicator. The best way to think about it? It's a clue. A very specific, measurable piece of data that gives us a snapshot, a little glimpse of what's really going on with the health of a whole lot of people.
But, not all clues are created equal. A really good one, an ideal indicator, has to be valid. I mean, it has to actually measure what it says it's measuring. It's got to be reliable, so we get consistent results. And this is a big one, it has to be feasible. A clue is totally useless if we can't actually collect the data for it, right? And of course, it needs to be relevant and specific to what we're investigating.
So, where does a health detective start the investigation? Where you start with the most fundamental clues of all, the ones that have to do with life and death. These are what we call mortality indicators.
Our first major clue is life expectancy. This one answers the big, simple question: how long are people living? It's an incredibly powerful summary of a country's overall health. It reflects just about everything, from nutrition and sanitation to the quality of healthcare over a whole lifetime.
But some of the most revealing clues actually come from the very, very beginning of life. The infant mortality rate, or IMR for short, is an unbelievably sensitive clue. It tells us so much more than just the health of babies. It tells us about maternal health, about access to good medical care, about sanitation and nutrition in a community.
Okay, let's make this real for a second. This number, 34.0, was India's infant mortality rate back in 2016. What that number means is that for every 1,000 babies born that year, 34 didn't survive to see their first birthday. It's a single number that tells such a powerful and often heartbreaking story.
Okay, so we've looked at how long people are living, but that's only part of the story, isn't it? Our investigation now has to dig a little deeper. We need to ask a more complicated question. Is a long life necessarily a healthy life?
And this is a really crucial point. A long life full of sickness isn't the goal. So we need clues that measure the burden of illness and disability within a population. These are known as morbidity and disability indicators. And trust me, they paint a much, much richer picture of a community's true well-being. Now here are two clues that people often get mixed up: incidence and prevalence. But I love this analogy, it makes it so easy. Think of incidence as the drip from a leaky faucet. It's the number of new cases appearing over a period of time. Prevalence, on the other hand, is the puddle on the floor. It's the total number of cases, both new and old, that exist at one specific moment. You really need both to understand a disease's impact.
So, you might be wondering, is there a tool that combines both the quantity and the quality of life into one super clue? Well, yes, there is. It's called HALE, or Health Adjusted Life Expectancy. This is a game changer. It doesn't just tell you how long you'll live, but how many of those years you can expect to live in good, full health.
And right here, you can see the real power of HALE. That first bar might be your total life expectancy, but the second one is your healthy life expectancy. And that gap, the space between them, that's what's so important. It represents the average time a person will spend living with illness or disability. A smaller gap means a much healthier population.
Our investigation is going great, but a good detective knows you can't just look in the obvious places. Now we need to widen our search and start looking for clues in some places you might not expect. Because here's the truth that every great detective eventually figures out. Health isn't created in a doctor's office or a hospital. Not really. It's created in our homes, our schools, and our communities. The world around us leaves fingerprints all over our health outcomes.
I mean, environmental clues are absolutely everywhere. Things like access to safe, clean drinking water and basic sanitation are probably the most critical. But it also includes things like the quality of the air we breathe, water pollution, even noise levels. The health of our environment is a fundamental indicator of our own health.
And the very same thing goes for these socioeconomic clues. Now, they don't measure a disease directly, but they are absolutely essential for understanding the full story. We're talking about things like income, education levels, unemployment rates, and even the quality of housing. These factors basically build the foundation that a community's health stands on.
Okay, we have gathered a ton of clues, from life and death stats to the quality of our air and water. Now it's time for the most exciting part of any investigation, putting all the pieces together to finally crack the case. Because here's the thing, a single clue is never enough. It's like trying to drive a car by only looking at the speedometer. You can't. You need to see all the gauges on the dashboard, the fuel, the engine temperature, everything. It's the same with a population's health. You need to look at all the indicators together to get the complete picture.
And you can see this in action in the real world. Think about huge global initiatives like the Millennium Development Goals. They relied on very specific indicators, like reducing child mortality or improving maternal health, to set clear targets, track progress, and hold entire countries accountable. So you see, these clues aren't just numbers on a page, they actually drive real-world change.
So, as we close our case file, I want to leave you with a question. Now that you've seen the detective's toolkit, now that you know all the different kinds of clues we use, what do you think is the single most important sign of a truly healthy community? Is it how long we live, how well we live, or is it something else entirely? The answer, I think, really reveals what we value most.